when I arrived at UT, I thought that everything I knew the students should learn. Not just learn it for the exam, learn it for the course, but learn it for a lifetime. Make sure that they learned long term, not short term. There were not very many faculty, so you taught lots of stuff. And Dallas Goebel and Bob Jones and myself were teaching surgery in the surgery lab. And that day we're particularly teaching how to do hand ties, telling the students it's important that you learn how to do this. But all three of us were left-handed. And so we're trying to teach a bunch of right-handed students how to do hand ties with their left hand. It was probably the only class who left that day totally frustrated because they were trying to use their bad hand to learn a good hand trick.
I had an option of going either here or to the University of Georgia, and then I got a call from Dr. Armstead that says we have a provisional good assurance that we will have funding for the vet school. So the legislature had not met yet, but then Georgia was pressuring me, so I said, hey, this feels right. Here we go.
The college was founded by an MSU group, Michigan State, and I'd been a graduate student at Michigan State with Dr. Bob Michel. So we knew each other, and also he wanted somebody that he knew could run a laboratory and had experience with the necropsy laboratory and the other ancillary laboratories, and I'd done a lot of that in Australia, and we'd done a little bit with him up in Michigan State. So that's how the invitation came through. They brought me down. It was about the time the first building was being designed. The first plans were there, which they rejected. That was interesting. And but when I saw the final plans, there was very little research space. And so I actually refused the job. And then they decided that they'd invite my wife.
But I wish I would have realized that things were going to change drastically within 35 years, what we teach, the way we teach, whether we do laboratories or whether we don't do it. But there is a continuous change in what we have to teach.
I'm a native Tennessean, and somebody sent me an ad that was telling about the college being open. And I just decided on a whim to send an application. And so for me, it was an opportunity to come back home.
Decided on a surgery career, moved to Davis, California, and I completed a surgery residency. The job opportunity became open at that time when I ended my residency. So I came here and interviewed in 1976. Enjoyed the area and enjoyed the people. And so I was fortunate enough to be offered a position, and that's how I came.
Went to a national meeting, and one of my committee members was a classmate of Dr. Kitchen, who was a department head here in one of the earlier departments. Met in the hallway and introduced me, and I just said, well, gee, I applied but never inquired, never got a response. So shortly after I got back to my institution, there was a phone call saying apply for a position which turned out to be a teaching and research mainly position.
I was teaching at Ohio State at the time, and Dr. Gage called and said that he thought I would be interested in a position here, and I'd be interested in coming down to look around. And I said no. I had a really good job at Ohio State. I enjoyed what I was doing there, and it looked like I was going to be able to do some additional teaching there in addition to what I was already doing.
I needed a job. I had just finished my PhD. I was being a postdoc at the University of Kentucky doing veterinary parasitology, doing research with horse strongyles. The veterinary college started here, was built about that time, and it was an ideal place for me. I needed a job, they needed a parasitologist, so it worked out well. I walked in, and I remember when I first started lecturing, I could feel my heart was just beating so hard. I thought they're going to know how nervous I am. And I thought for years, whenever I would have the first lecture of that first semester with the new class, I felt nervous, with my heart pounding. And I thought, well, I guess it'll be like that for the rest of my life. The whole time that I teach, that first lecture is going to be, I'm going to be nervous. But that's gone away. I'm not nervous anymore.
At that time of my life, I was working at Kansas State, and one of the difficulties there was that I was doing clinics 100% of the time, and I was the only person in my discipline. And the opportunity to come to a new school, working with a group of people doing small animal medicine and surgery, the opportunity to have some time for professional development, and the appreciation of teaching were all very, shall we say, enticing. Another important issue was the fact that I was able to come and work with Dr. Bill Armstead, probably the most significant veterinary educator of that period in time.
Having now taught for 40 some odd years, the most gratifying thing that happens to me is that I'll be at a meeting or a convention somewhere, and some student who I remember their face but not their name comes up to me, who maybe I taught 30 years ago, 40 years ago, and they come up to me and they say, Dr. Carmichael, I want you to know I still use and I still remember and use some things you taught me 30, 40 years ago. And they'll go on to say that they don't remember a lot, but they remember the important things.
I really enjoy the discovery by the students. There's nothing that quite turns you on to teaching any more than having the students see that light bulb turn on and see that they've identified something they didn't previously know. And that's been most apparent in the physical diagnosis course, where we teach things like abdominal palpation, where all of a sudden they find a kidney in that cat, and that's the first time they'd ever felt that. I've had students come back to me and say, you know, I called home after the lab last week and I told my mom and dad that I'd found a kidney in a cat, and they really feel like they're getting there as veterinarians.
Well, obviously I'm a foreigner, so there was this difference in presentation. Of course, this particularly so if you go to the Midwest, and I went to Kansas State. But of course, obviously I have a problem with my R's compared to a Midwesterner. Maybe some Southerners do too. But so there was some amusing incident. And I remember one specific incident, I used the word larvae, and you could see from the oscillating eyes and so on. And remember, there were no handouts, you know, no printed material. They were taking notes. So I wrote it on the board, which is what I normally did. And you could hear the sigh. And so I wrote L-A-R-V-A-E, or V-A, I think was singular. And I said to them, turned back and said, what did you think I said? And a voice from the back came up and said, the stuff that comes out of volcanoes.
Something interesting was kind of unique. For some reason I realized that, or got in mind that our veterinarians, especially large animal vets, should know automechanics. And then for some reason I developed a course on automechanics. I think I call it a automechanics clinics or something like that. Then we got together with the students every weekend and sometimes during the weekdays and fixed their car. I helped them to do it. I gained a lot of expertise on that. And what is quite interesting is that today many of the old veterinarians or graduates, when they see me, they remember what I taught them about cars and not what I taught them about physiology.
To see those lights come on, our deaf friends have a sign that goes like this, which means, oh, I get it. And I love to see that light come on. So that's really gratifying to me.
What I say and what I did during those years does make an impression, and students do remember.
Being present for that teaching moment that when you have the opportunity to give a small bit to someone who perceives that as valuable at the moment. And in my case, that happens with students. I guess I would consider everyone who seeks my professional opinion as a student.
Talking, and I had 2 lectures to the technicians and 1 to the veterinarians. So I go into the veterinarian part, and here is one of our students there, which is Whit, and I had not seen him in several years, and so I was talking to him. And he said, I told the people in my practice that I'm going to her lecture, and I'm hoping I'm going to get a chance to say voracious bloodsucker. So and it happens that the lecture is on parasites that cause anemia. So I'm talking about the puppies, and I say, I ask them sort of, what would be happening in this puppy? Why are we seeing these clinical signs? And nobody seems to know, and they don't say. I said, no, but what are the worms doing? Why is there a problem? I said, okay, Dr. Whit, and he stands up and yells out, voracious bloodsucker. And I said, yes, that's right. Now let's all do as well. So then I got the whole group to answer. But that to me is just a lot of fun. And everywhere we go, people are expecting that they're going to be asked, and they're going to answer a voracious bloodsucker.
Being a university professor is an ideal job. You work in a very positive environment with people who are interested in learning. You work with people who have a common goal and work towards the betterment of your profession and society. I think one of the most gratifying things is the ability to interact with students, because if you're interested in developing professionally, they are the people who challenge you to do so.
It was easier to be a teacher 35 years ago. We didn't have all the pressures that you faculty have today. They come in to this institution, they are given the mandate of you must be a good teacher and you must develop a good research program. And by the end of a year or 2, they feel the pressure at the point they become very frustrated. You've got to learn to prioritize what you're going to do. And you've got to learn to utilize your time well, and don't get so committed to one thing that you don't have balance to include your teaching and your research.
Enjoy your teaching. Go ahead and relax. Don't worry too much about it. Put some enthusiasm into it so that the students realize that you do enjoy your teaching, and you do enjoy that transmission of education.
Be yourself, try to teach what you think that should be taught, and on the top of that, be happy with what you do.
I've come to realize that caring meant more than just emotional caring. It meant caring enough to prepare well. It meant caring enough to be organized. It meant caring enough to write test questions that were both fair and challenging. It meant also caring enough to sit in the office and listen to students and try to help them with issues they may be having.
I would tell them to pal around with the good teachers. Avoid people who complain about students, who complain about schedules, who complain about administration and how hard the job is. Stick with those who are passionate teachers, who enjoy the job, who care about students and the subject that they're teaching.
To surround yourself with good people, to remain adaptable.
I didn't realize that for me it took someplace initially between 8 and 12 hours per lecture to get everything organized, to work all the bugs out to make it what I wanted it to be from a learning standpoint. I'm able to cut that down after a few years, but it still takes me 6 to 8 hours per lecture, even on one that I'm remodeling.
How to really manage the class, I really didn't know. I just sort of learned that by making mistakes. They would come in, they wouldn't get quiet, so I would stand up there and just think, well, eventually they'll notice I'm up here. Well, they never did, so things like that. But, how to give exams, I really had no idea how to do that. I think the first exams that we gave were fine, but I think we do a much better job now.
It's a matter of constant study to develop expertise in the discipline.
Fun, productive, and rewarding.
I hope it's been effective. It's been enjoyable for me, and I hope I've been some influence on many students.
Don't regret, be happy, and I am so satisfied doing what I have done.
Fulfilling. Number 2, fun. And number 3, hyphenated, too short.
Stimulation of the students to learn, satisfaction of being able to teach and have them learn, and happiness over the whole thing working out.
Voracious bloodsuckers. I end lectures by telling them, remember I love you. And somewhere along the way that all became so true.
Care, passion, and honesty.
Satisfying, challenging.
Organization. And the last one would have to be a combination of 2 words, which I mentioned earlier, which is fair and challenging.
I think all I can say is I'm grateful for the opportunity.